Recently, it's been a challenging time as families grapple with a nationwide shortage of safe and affordable baby formula. Though breastfeeding is the natural and most beneficial way to feed your baby, there are times when breastfeeding is not possible. Medical supplementation is necessary or families decide not to breastfeed. The recent baby formula shortage has affected many families and continues to worry parents. What are some options for parents and how can you safely feed your baby during this trying time? Hi everyone, I'm Daniela Contreras. I'm here with Lyndsey Williams, Enloe's Lactation Program Coordinator, and Amber McPherson, Program Manager of Butte County Women, Infants, and Children, to discuss resources available and helpful tips for parents. Hello Lyndsey and Amber, thank you so much for being here today.
My pleasure.
Thank you for having us.
So I'm going to start with you, Lyndsey. Can you tell me how much and how often should a baby be fed?
Babies should be fed on demand, so anytime they show hunger cues, and that's a little bit different for each baby. Babies that are partially breastfeeding and formula feeding, they may take more frequent feedings that are smaller, and babies who are exclusively formula fed may go about 3 to 4 hours between feedings. Typically a baby in the first few months will take anywhere from 3 to 4 ounces, and by 6 months they could be taking up to 6 to 8 ounces. Granted, this is different for every child, and so if all babies don't fit within that category, that's okay.
Lyndsey, so what are some options for parents who are looking for baby formula if they can't find it in their stores?
We recommend shopping at several different stores, reaching out to family and friends, asking them to keep an eye out for the specific formula that they're looking for so you have several people shopping for you. Calling the stores beforehand to see what's in stock or what days they might be restocking the shelves can be helpful. If you're a WIC participant, reaching out to WIC. And if you truly can't find any formula in the store for your baby, please reach out to the pediatrician's office.
So Amber, can you tell us a little bit about WIC? How can this program help parents who are looking for baby formula?
So WIC is a supplemental nutrition program for women, infants, and children. And through our program, we provide formula as a benefit for infants who are eligible. We can also help navigate parents through the crisis right now. We have staff going out to local vendors, checking on the supply. So we can help parents if they can't find a specific type of formula. Also, California State WIC is shipping specialty formulas directly to our local offices. So if you have a baby that's on a specialty formula, we can help get that for you as well.
Oh, that's great. How many baby formulas does the WIC program cover? And what happens if one of those is out of stock?
Yeah, so right now they're actually offering a lot of flexibilities. So California State WIC has really jumped up to the plate for this. So they are basically allowing flexibilities to offer over 108 different formulas. So you can pretty much buy any formula off the shelf right now if you're on the WIC program. Normally we only provide 5 different brands, but right now they're offering those flexibilities until August 31st.
Oh, that's awesome. Lyndsey, is it okay or is it safe to switch between baby formula brands?
It is, in most cases. Babies generally can tolerate other brands of formula unless a baby requires a special therapeutic formula due to an allergy or intolerance. And in that case, we would encourage them to discuss that with their pediatrician first.
And can you tell us a little bit about milk banks? Like, is it common to use them? And if so, how can people go about accessing a milk bank?
Sure. So the donor milk bank, an accredited donor milk bank, is very safe. They screen the donors and they pasteurize the milk. The donor milk bank here in California, in San Jose, is actually very safe. They've been open since 1974 and have never had an incident of a baby falling ill from the milk. So it is safe. However, it can be costly for the family, so it's not always a financial option depending, and the supply is also low for them at times, so they're needing donors as well. But we certainly encourage reaching out to the donor milk bank, and you can do that by going to the website mothersmilk.org.
Oh wow, that's a great resource. Lyndsey, we've heard about parents who are considering using cow's milk or goat's milk. Is this something we recommend?
We don't recommend giving cow's milk or goat's milk to infants under the age of 12 months. They are high in protein and minerals that just are not nutritionally appropriate for the baby. If parents are getting to the point where they haven't been able to access their formula and they're feeling that they may need to give an alternative milk option, we encourage them to reach out to the pediatrician so that they can decide based off the child's age and medical history what's the best alternative.
Oh, that's great. Now, Amber, we've heard about some people trying to make their own baby formula at home. Is this safe?
We understand that it's a very stressful time for parents right now. Trying to feed their babies and having the formula shortage can be very stressful, but we don't recommend making your own homemade formula. Babies' digestive systems are extremely delicate, and formulas that are made in a factory are made specifically to meet a baby's nutritional needs. When you make your own homemade formula, you're not going to meet those nutrient needs, and it can actually be very dangerous if you make it improperly.
Can you tell me if WIC helps breastfeeding mothers too?
Yeah, so we have 3 lactation consultants actually on staff right now that can help provide breastfeeding support. And we also train all of our staff to become certified lactation educators for some of those not so complex breastfeeding issues.
So what happens when a mother is experiencing a low breast milk supply? Is there any way that we can increase this, or that the mom can do something to increase her supply?
Certainly, yeah. We encourage first reaching out to a lactation consultant. We're fortunate in Butte County to have a lot of lactation resources for moms, so reaching out to lactation so that we can help come up with a plan to help that mom increase her supply. But feeding more frequently at the breast is the best way to increase your supply. Pumping sometimes after feedings can help with that as well. And so yeah, just seek support because there are many options that we can do. It's not always a fast process, but it's definitely beneficial.
Oh, that's awesome. So what happens if the baby is already weaned off breast milk? Sure. Is there any way to restart lactation?
Yeah, so relactating is possible in some cases. Oh, nice. In fact, you can induce lactation even if you haven't breastfed before. Now, it does take some time and patience and a lot of guidance, and so we certainly encourage reaching out to a lactation consultant so that we can walk the mom through that process.
Oh, wow, that's great information. What are the qualifications to be able to access WIC?
So you're automatically eligible for WIC if you have Medi-Cal, CalFresh, or CalWorks. And then also if you meet a specific income requirement, you can be eligible based on your household size. So I recommend calling the WIC office to see if you are eligible. You can also go online to the Butte County Public Health website, and you would just choose WIC from the drop-down menu, and we have an online application you can fill out.
Oh, perfect. And is it a fast process?
Yes, it's a fast process. We just basically have to call you back and get you booked for an appointment. And we can tell you if you're eligible right away. We have income guidelines that we can view.
Oh, perfect. Are there any local food banks that are also helping families go about accessing baby formula?
There are local food banks. I can't speak to what their supplies are because it does change daily. We do get a lot of calls from local food banks and from just concerned community members that are wanting to donate formula. So we definitely have been brought in as helping that process.
So Amber, is there anything else that you would like to add that I didn't ask you?
Yeah, so I just want to say that I'm very optimistic that we're at the tail end of this shortage. The formula companies have assured WIC that they've ramped up supplies. We're also seeing a lot of formula on our vendor shelves in Butte County. Also, the FDA has announced that they are going to continue the import of formulas from other countries. So right now we're receiving formula from over 9 different countries that's being shipped in and put on our store shelves.
Oh, that's great to hear. It's very reassuring. Thank you both again for being here today.
Thank you for having us.
And thank you so much for watching. If you enjoyed today's discussion, be sure to catch Enloe's podcast, Health Matters. We placed a link to it in the comments field. Goodbye for now.